So from one commercial success story to another, SyntheticMR, public company enjoying 1.3 billion in market cap. Does anyone have a guess how much money they've raised until now? Just shoot me a number. 1.3 billion market cap, how much money has the company raised until now? Shoot. Well, yeah. Digits. With 40 million SEK, the company is at 1.3 billion. And I'm happy to introduce to you guys Stefan, the CEO of the company. Take us through the story.
Thank you very much. Okay, so this will be interesting. I will try to do a quick presentation of SyntheticMR if you are not aware about the company and the products, and then I will be asked to spend like 10-15 minutes on the commercialization trip. Okay, so just a brief overview to begin with. So the company was founded in 2007 in Linköping, Sweden. The company is still in Linköping. Pretty early, the product was developed and CE marked actually, but it was, or they realized at that stage that it was a little bit too early to bring the product to the market. So further development was done, and I was brought on as the first externally recruited CEO in 2011, late 2011, with the task, basically it was like this. So Stefan, your task is to commercialize this product. Here you have 2 million in cash, 2 employees, and 2 half-time employees. Okay, so that, and I like challenges, so so I took that one. And I will come back to the storyline later on. So the slides about commercialization is basically built on the timeline. So we'll come back to that. Today, anyhow, we are present globally. So our product is sold on a global basis, so sort of in every corner of the world. We do have loads of research collaborations globally as well. And this slide sort of makes me happy actually when I think about the time in 2011 when I was sitting there with the 3 FTEs and me, and we were trying to start to get this sort of niche product out on a global market. Okay, so MRI market, we have heard in the previous presentation about MRI, so it's the perfect thing for soft tissues, but it's an extremely consolidated market. So you have Siemens, Philips, and GE, who has approximately 75-80% of the global market share when it comes to MRI scanners. There is 3 trends and driving forces. Simplicity, so it's very complex to run an MRI today. It takes time as well. So therefore, efficiency is important to be able to run through more patients in a sort of time frame. And quantification. So in a lot of other technologies like CT, for example, or Vator tomography, you can quantify things. But with an MRI scanner, you can't really do that, at least not in a standardized way. Okay, so I will not dig into the technology, but the thing is that in a conventional MRI, you would run a series of different scans. Each scan would produce an image. Each type of image with settings would sort of be helpful for a different type of diagnosis. But the radiologist actually needs sort of a set of images in order to compare and make a diagnosis of the patient. The difference between that, and you could basically say that this would be to compare with analog photography, as we did in the 90s and earlier. The difference between that and synthetic MRI is that we do 1 scan, 6 minutes, collect a lot of raw data, which we run into our software, apply our Coca-Cola recipe, which is the algorithms, do a calculation, and then you would get quantitative maps. So what you basically get is actual measurements of the tissue properties of the patient. And since we have that, even after the patient has left and gone home, you could do a lot of things. You could either synthesize images, so comparable to the conventional images, with different scan settings. So we synthesize an MRI scanner, basically. But then we could do other things as well. We could do segmentation of different tissue types. So we could add 2 different type of values, basically. More information in shorter scan time. And we do have OEM agreements with 3 big ones, which I will come back to. Those differs a little bit between them, but we do have them, and that's actually a success story, to be honest. Not many companies have accomplished that. And this is sort of the trip since 2015. So 2016 was the first profitable year. So that's sort of our 10th year in operations. And we have had a nice growth since then. Okay, so how did we get there? So as I said, when I joined in 2011, it was a small company, 3 FTEs, me, and some cash. The first thing we did was to create a go-to-market plan, of course, and to review. I mean, I have a background within Siemens where I worked with strategic planning, and you more or less have to do the same thing with a small startup, right? And you are approaching a global market, but I did have a lot less resources than I had when I worked with Siemens. So you just have to do all those things with market analysis and competition and so on and so forth. Anyhow, we came up with that the only way out on the market with our technology is to go with the big manufacturers because we have technical dependency to the MRI scanner. So the idea in this strategic plan was we should go with the GE, Siemens and Philips to begin with, create a product that they could implement and sell on the scanner. And then the sort of next level of growth for the company would be to position a product into something called the reading rooms, where the radiologist actually is sitting and do the diagnosis of the patient. Logic, it's vertical, and yeah, so that I read about that in business school, so that sounds fair. So yeah, so that was the strategy, and then we decided together with the board that we shouldn't go for any exclusivity agreements because we thought that would bring too high risk. And one of the first decisions that I took from a technical perspective was to protect our core value, which is the quantitative maps. So we decided to encrypt those. So that was sort of the 4-point essence of that big work that we did. Yeah, so then it's just about execution and implementation, I guess. And a few learnings is that I'm convinced that the inventor is really, really important in those early stages because nobody else can sort of sell the technical solution with the same passion as the inventor can do. He or she actually is the one that knows what was the idea, what is the problem that I would like to solve, and so on and so forth. And so I would say that was a success for us. So me and Marcel, who is the inventor and the founder of the company, worked really, really closely during the beginning of the company. And the next one, I think, is equally important. So you have a great technology, but I mean, if you're going to create a collaboration with those big companies, you need to understand what would sort of take them to bring on our product into their product. I mean, that's a big commitment, right? So I'm sure that you have to look for opportunities where your product can strengthen their product, or how can your product help them to succeed with their strategy. That's sort of a really, really important point, to be honest. So therefore, you need to be responsive and adaptable. So you have to listen more than you talk, basically, and be open for adjusting the product and adapting the product to the need of the customer instead of just being hardball and try to push out your original idea. And we did it. So the thing was that I said that we were aiming for GE, Siemens, and Philips. Given that I have a background from Siemens, I know that the company culture within Siemens is not invented here. So it's a very engineering-oriented culture in that company. GE is extremely market-oriented. So normally I say that in GE, the marketing department tells the R&D department what to develop. In Siemens, the engineering department tells the marketing department what to sell. Here we have this perfectly engineered product sell. And Philips is followers, I would say. They are sort of on the third place. So I decided, when we started to execute the strategy, I decided that we would go for GE to begin with, because I thought that they would be more open for sort of technologies developed outside GE. At this point of time, so in 2014, we signed a license agreement with GE. At this point of time, in 2013, GE had received a lot of market feedback that they weren't perceived as innovative as the customer wished they were or would be. So by hearing that, I started to use the word innovation or innovative product, or SyntheticMR is a very innovative product that would help you to increase to be more perceived as an innovative company and so on and so forth. So, and I think at least that helped us. That's about listening, right? So by using the same type of words, you could sort of get into the organization, and they had an easier way to perceive that, okay, by bringing on this, we will resolve this innovation problem, or it will be one piece of the puzzle at least. And to be honest, they decided to release, or in 2014 at the big conference, they released a perfectly new scanner under a new brand, Signa Pioneer. And SyntheticMR, or branded as Magic, as it is within GE, was one of the 3 key features. And it was the only third-party key feature that was released with the scanner. So that was really a nice story, actually. So with GE, our agreement is that we sell our software as a black box. They take the rest of the responsibility. So sales, marketing, regulatory responsibility, so on and so forth. So it's a really scalable business model. So if they sell another 100 licenses while I'm having this speech, it wouldn't cost the company a dime, basically. So that's a nice business model. And it was a nice product release, actually. My chairman said that the only bad thing with this, Stefan, is that you are 42 years old, which I was at that point in time, and you will never experience such a product release again. So that but I can live with that, I think. Okay, so with that done, then the work started together with GE, and they started to roll out the product in the market and so on and so forth, but we still had to sort of frame Siemens and Philips, right? And we managed to do so. So we had an agreement with Philips in 2015, and the first agreement with Siemens in 2016. Those agreements differed, though, because they were co-marketing and cooperation agreement, so not an integrated product on that level, as I explained with the GE. But we still have the collaborations, and first check in the box is that their scanners are compatible with our technology. And the second checkbox we're working on at the moment, and that is to develop this to reseller agreements to sort of ease up for their regional sales organizations to offer the product in the market. One important thing here, though, is that they decided, do you remember that I said that our strategy from the beginning was that we would offer a product to the Siemens, Philips, and GE that they could sell on the scanner, and then our next level of business model would be in the reading room. Okay, so here the reality struck us, because Philips and Siemens decided to position the product directly in the reading room, sort of where we have thought that we would have the next level of growth. So then we had to adapt again, and I will come back to that. And with Siemens and Philips, so the regulatory responsibility and more marketing and sales costs sort of remains with us, but on the other hand, we will earn more money per license. So in 2016, we prepared for FDA clearance on our product. Okay, so given that Siemens and Philips decided to position the product in the reading room, we had to sort of rethink our strategy to ensure that we had a growth strategy for the future as well. So you could argue that we changed from a vertical strategy on more to value-based strategy. So instead, earning money on increased value of the product that we deliver. Coming back to the quantitative maps that I talked about before. That's sort of our core value, that we have a standardized way to measure. And we are actually the first company that could argue that we have a vendor-independent way of measuring with MRI scanners. And when we have that, you could start to add on things, right? Automatic tissue segmentation of tumors, so on and so forth. For each of such application that we develop, adds clinical value. And that could be a clinical app, right? So we are working on that at the moment. So that was a change where we had to adapt due to the agreements that we have with the OEMs. Okay, so with this slightly change in strategy, we had to start to implement that as well, of course. And one of the first thing was actually that we signed a new agreement with Siemens in 2017, and that is with something called the Syngo Open Apps. So Siemens has released a new software version where they can offer apps like you have in your iPhone or smartphone, which could be downloaded to the hospital, and then they could use it in the Siemens system on premise or locally, with a new business model as well. So it's subscription based, which is sort of a new phase in the healthcare industry. So that was a good step. We have on our side increased attendance with our own booth on conferences, both radiology conferences, but as well clinical conferences. So we need to move closer to the clinicians. And we are currently developing our first clinical apps in the pediatric area. But there is still scalability to do in this business, right? So we have those 3 agreements, and we have commercial agreements with GE, Siemens, and Philips, and the commercial majority is high on GE, but low on Siemens and Philips, and there is still actors to approach and where we have discussions. And the other thing is how much of our product portfolio do they actually offer? So even though GE is our most important customer, they are just offering 50% of our product portfolio at the moment. So there is a lot of growth to do in those channels as well. Some summary then. So I think persistence is, given the last speech that we heard as well, persistence is sort of the most important thing. And that you have a focused strategy. When I joined the company, we did sort of several different things. One of the decisions that we took was to just focus on brain exams, for example. I think it's really, really important to focus until you get into the market space, and then you can sort of grow sideways again. As we heard in the beginning, 40 million is the venture capital. More money is not always the solution. I mean, it depends on which type of company and how the market plays and the sort of environment that you are existing in. But in our case, I mean, if we would have had 100 million, it wouldn't matter. It's about pushing the OEMs in the right direction, right? And yeah, so I'm sure that that's an important learning point as well, even though that sort of impact of that was that we sometimes flew via Istanbul to Chicago in order to get cheap tickets, but okay, so medtech takes time. I mean, that's just the reality, right? I mean, 8 to 12 years for sure. before you're actually out there. But on the other hand, long lead times build stickiness, and I'm quite sure that this is also the reality. If you have sort of enough money and enough time and a good strategy, and you get in there, right? Then you build very high barriers for others to entry. So I think it takes, I mean, it's really challenging for somebody to try to do the same thing and convince Siemens, Philips, and GE to bring on their product as well. And I like that quote. Strategy without tactics is slowest road to victory. Tactics without strategy is just the noise before defeat. Okay. And this is the reality as well, I think. So I mean, if you are doing this, I think you just need to be a person who loves to be on the emotional roller coaster. And this is, I mean, this is not like you have 2000 or year 2007 here and 2018 here. This could be in the morning or an afternoon. You're a king in the morning, but oh yeah, I think we'll get that agreement actually. It's really, really, really nice. And then you get some negative news. And they're like, oh, we will never succeed in this. And then you're up and down and up and down and up. So. Yeah, so I think that's about it.